The next of the spiral-shaped organisms we're going to talk about is Leptospira. Again, not as important as Treponema and Borrelia because we don't see very many cases in the continental U.S. The organism, though, is very characteristic. If they were to show you an image of it, it would be very easy to recognize because it has hooked ends. So if you've ever seen one of the guys like Salvador Dali with the handlebar mustache that kind of gets hooked there on the end, it's kind of what the organism looks like. It's spiral-shaped, and then the ends on both sides are hooked. So if you were to see an image like that, it's very easy to tell that that's Leptospira. We're going to talk about Leptospira interrogans. That's the species that is most often associated with disease. And as far as distinguishing features, again, we're looking at serology or perhaps dark field microscopy. And the reservoir here are wild animals. This is a classic zoonotic disease. Now, the transmission is associated with contact with water that has been contaminated, usually with animal urine from infected animals. Now, take that one step further, where you're really going around playing in the water. Jet skiers tend to get Leptospira. And in the U.S., Hawaii is actually the highest incidence state for leptospirosis. Okay? So jet skiers, sewer workers, anybody having contact with water that may be contaminated with a large amount of animal urine is susceptible to getting leptospirosis. As far as virulence, there's not much you really need to know about virulence. The disease is called swamp fever or mud fever because of the association with the water. It is a flu-like illness with or without GI symptoms, and it can progress on to hepatitis and renal failure if it's untreated. So it's not something you want to leave alone. You definitely want to treat it. It may be hard to diagnose, though. So if they were to use it on step one, again, they're probably going to mention some kind of contact with water, maybe flu-like illness, again, additionally with hepatitis, and that might be enough of a clue to help you with the diagnosis of leptospirosis. How do we diagnose this? Again, serodiagnosis can be used, microscopy can be used, but as far as culturing it, it's not really very readily available. Now, the drug of choice for leptospirosis is penicillin or doxycycline, and prevention really goes back to vaccination of domestic livestock, pets, and control of some of the animals that have a high incidence of leptospirosis. Rats are really high on that list.